told to go to the emergency room, which we did. The emergency room directed us to get in touch with a wound care provider. So the next day I called for wound care, and they told us that we would have to have a referral to see wound care. And at that time I had to find another podiatrist, short-term, when they were doing research, because we saw the ulcer and it didn't look terribly bad, but I knew it wasn't supposed to be there. So once we found a podiatrist, we went to visit him, and the first day after we got our appointment, he measured the wound and told us that we were doing the right thing and using the wet patch. I had to become a nurse, I guess, to change his patch, the bandages on his foot. And I bandaged his foot the best I could in between the visits to the podiatrist. And it looked like every time we went back, all he was doing was measuring the wound. He wasn't doing anything. He did prescribe us some cream at one time, and we put the cream on, and it looked like the wound was getting better. My husband's history is he was recovering from a spinal stenosis, and when he came home from that, he was unable to do anything. So I had to take off work to be his full care provider, nurse, caretaker, until he was able to move just a little bit. But flash forward, you're handling the ulcer on his foot, and every time the doctor, when I went there, I specifically told him that we needed a referral to a wound care provider. We never got that. So flash forward 7 months after seeing this doctor, and I did question him. I said, it looks like the wound's getting worse. And he said, oh, he's going to be fine, but it just takes time to heal. But 7 months down the road, he finally gives us this referral to go to the wound care. And when we go to the wound care, the first thing they tell us is that he has gangrene, there's nothing we can do, and they wheel us around to the hospital side and schedule us for amputation. My husband, he was drinking at the time, he was smoking at the time. He quit that day. He has not smoked or drank since. Because we had a split level home, our living room became his bedroom. And I had to finagle, if you would, and I was juggling so much. My father was sick at the time, my husband was sick at the time, my daughter was doing what she could to help take care of him. And she was a teenager, but she did what she could. Again, I was the nurse trying to do what we could. And it changed our lives tremendously. My husband's brother, he has a second oldest brother, would come by and try to be the rehab, if you will, to give him strength, to try to motivate him to do this, to do that. And he had another brother that was next in line to him, who was also there, and he was a double amputee. But he was doing what he could. So I consider myself an optimist by nature, because the glass is always full, because God is always good. It is with the help of his brothers, and both of them are dead and gone, that was my support system. And I didn't know how I was going to make it, but we had neighbors kick in and do things for us. We've had other family members kick And he's still here, we're still fighting. One other thing I want to say, and what I would like for people to know, is that doctors, to me, they're educated, they're so educated, but if you don't have the bedside manner or you don't connect with your patients, it does make a difference.
Amen.
And I think it's called the Hippocratic Oath. It says, first do no harm. And I don't think that every doctor listens to that. I don't, because I don't think he should have lost his leg. But we're here now. We're going to make the best of it. We're going to keep fighting. We've got the best doctor in our corner. That's right. Continue to fight this fight.
Can't control him. Can't stop.
So,
You got Lord on the side. It's hard to stop when you do taste of it. It's hard to let it go.
it doesn't just affect the amputee. It affects the families, it affects their friends. A lot of our friends don't have, we can't visit them at their homes because their homes are not equipped for us to go there. So everyone has to come to our home, but we had to move because of his situation. So we had to move to a single level ranch, which we love, but it affects everyone in your life. It changes your lifestyle once this happens. And we're still fighting, trying to get adequate health care, wheelchairs, whatever we need, we're still fighting the fight. So, but we're not going to stop. So thank you for your time.
This last thing, you find out, like she said, you can't go to your friend's house, but you find out who your friends are. I'm talking about, really, you find out who's really in your corner. And she's been my rock since I met her, and she's still my rock right now. All right.
Just to have some normalcy. So this is hard. So we do need our lawmakers, our leadership to help us with some of these things for our amputees. And lastly, he has beat the odds. It's been 3 years. It's been 3 years, and we're doing well. So he's been part of this, having an interdisciplinary approach. Half the people in this room, I have your cell phone number, you know I call you all the time. I got a patient. I need you to see this patient. And you call me, and that's the way we need to attack this all across the country. I get calls from New Orleans. This is the way we do this. So thank you again.
Thank you.
speak loudly so that everybody can hear your question. Tell us who you are and where you're from if you're traveling, otherwise just say from Atlanta. To conduct the Q&A with the audience, we have award-winning Atlanta